My name is Lake, and I'm one of the internal medicine residents in the clinic here in town in my second year there, so I'm here to talk about bone health with you today. Okay, so I'll just talk briefly, kind of give an introductory kind of talk about it, and then certainly I'd like it to be interactive. I'd like to be able to answer any questions that you have and kind of make it pertinent to your life and what you're feeling and what ideas you have. Okay? So certainly there are over 50 million people with what's called osteoporosis, which is basically thinner bone than you should have, okay? It affects a lot of people when we age. It's just one of those things, wear and tear over time. It can get to us, okay? So basically when there's a balance, there's always a balance between bone growth and bone loss. And when we're younger, that bone growth is kind of supersedes the bone loss, so that's why you don't have bone net loss over time, okay? And usually that peaks at about the third decade of life. And then when we age beyond that, especially when we get over 50, that bone loss aspect starts getting higher than the bone gain aspect. And that's when gradually, year by year, we start losing that bone overall. We get that net loss, okay? And that, of course, makes us more prone to fractures, which is the big concern with anyone with a question about bones, is you don't want to break a bone, okay? As long as the bone doesn't break, you're feeling pretty good. Oftentimes osteoporosis is kind of a silent disease. You don't really know what's going on until something unfortunately bad happens, like a hip fracture, like a spinal fracture, something like that we certainly want everyone to avoid. Okay? There are screening guidelines for osteoporosis that generally start at age 65 for most people. That's when it's recommended by organizations to start getting screened for osteoporosis, okay? And that's no matter how you're feeling. You can be healthy as a horse and they still recommend that screening to take place, okay? That'll hopefully catch osteoporosis before a fracture happens, before an adverse event happens, and we're able to treat it effectively to help prevent those adverse events from happening in the future, okay? There are several aspects of lifestyle that can pertain to keeping bones strong, no matter if you're being screened for osteoporosis or not. One of those is dietary. You always hear about calcium and vitamin D, that those are important for bone health. Certainly calcium helps us form bones and keep them strong, and vitamin D actually helps our body to absorb calcium. So the problem is, if you don't have enough vitamin D, you can take all the calcium in that you want, and it's just going to be excreted. You're not going to actually retain it. It's not going to be able to get to the bone where it needs to go. Okay, so that's why vitamin D and calcium we always hear in combination, and that's why oftentimes when people take the supplements, they are in combination. It's a combined tablet. You might have seen those before. But they kind of work hand in hand and play off each other, okay? Another important thing besides those kind of dietary supplements we can take is exercise. Exercise is super important to maintain bone health, specifically weight-bearing exercise. So not like a bicycle or swimming, because that kind of takes the stress off our bones. You can think of bones kind of like muscle. Muscle, you use it, it grows, you get stronger. Bones kind of like the same thing. It's another living tissue, really. So if you use it more, if you put stress on it, stuff like walking, jogging, hiking, dancing, stuff like this, will actually help strengthen those bones over years. So if you do more things like that, that'll actually keep bones pretty strong. Okay? There are also things to avoid when you're talking about bone health. One of them is smoking. Smoking is linked to less bone health, to more bone loss. They don't really understand the mechanism why, but studies have shown that people who smoke have less bone health in general than people who don't. Another is alcohol use. Not only does alcohol use make you more prone to falls, understandably, it can also make your bones less strong as well. So these are two things that generally as health professionals we like to recommend to limit anyway, but it's just another reason to avoid or at least minimize those things is your bone health, okay? A third thing is sodium in your diet. Actually, if you have more salt intake, you'll actually excrete more calcium in the urine and things like that. So it's very important to limit, again, for other health reasons as well, but to limit your sodium intake as well, because that'll lead to your body retaining that calcium better, okay? So these are things we can do to help prevent the development of low bone mass, of osteoporosis. But if unfortunately osteoporosis does develop and you're diagnosed with that, there are treatments we can do for that as well. There are several different medication classes that I won't get too much into the details of, at least at the outset here, but they all help kind of build up bone that's been lost over time. It actually kind of works with the body's cellular mechanisms that it uses anyway, but kind of helps revert it back to what it was when you were younger, kind of in terms of the turnover rate and making that more minimal. Okay? So these are good medications that we can use to help combat after a diagnosis of osteoporosis has been already made. Okay? Are there any questions so far about what I've said?
What do they consider a normal rate of alcohol?
So generally, if you can keep it to, and I'm not going to ask how much you two drink, but if you can generally keep it to 1 beer or less per day, 1 alcoholic beverage or less per, that would be
Then.
that would be good. I mean, again, it's always the more minimum, the better. Everything in moderation, so to speak. But that's a good thing to help minimize, to improve your bone health. Does that list make sense that I have there with the calcium sources? I can grab one for you too, actually.
Not on there, but I think it was over on the front someplace. Calcium culprits, the role of calcium.
Yeah, because you hear a lot about you need more calcium in your diet, but what does that actually mean? You know, how do we equate that to actual real life and what we can use to get that calcium and how much we need in a day? So generally, once we hit 70, it's recommended that you have 1,200 milligrams at least per day. So you can see the individualized breakdown of the milligram amount in each of those food groups there. So,
1,200, that's a lot.
yeah, it is. And that's why oftentimes people use supplements in addition to the dietary intake that you can get. That's a useful tool that you can use if you want to add up the calcium that you get in a day and make sure you're at least hitting that benchmark. Because that's the recommended total intake to keep your bones good and strong.
I have a question about vitamin D supplements. I
Sure.
think a 1,000 unit, the little capsule that makes you think it's in oil in there.
Yeah.
Because it's a fat soluble vitamin, right?
Sure, yeah.
Is that better with food, or is it just that it's in your system? Because I take it at bedtime because that's when I take my other medication.
Yeah.
Should I think about taking it with breakfast instead?
Yeah, do you take a calcium supplement as well, or?
I don't,
Okay.
but I drink a fair amount of milk and
Sure,
cheese.
sure.
and-
Yeah, generally these supplements are often better with food. So I mean, they're going to help either way, but if you want to take it with food, it'll likely be absorbed a little bit better once you take it. So. Does that make sense why you need vitamin D with the calcium?
Yeah, I do know that.
Yeah, it basically helps the calcium do its job essentially, so it's very important.
Yeah. I've kind of somewhat avoided I used to take a calcium supplement, but I had a kidney stone once, and they never proved what it was, but one does not want to do that a second time.
Yeah, I hear that's not very fun to go through.
I did it 3 times.
Oh, bless your heart. Yeah, no, you don't want to do that again if you can avoid it, so.
Understood, certainly. Yeah, certainly if you can meet the recommended requirements on a dietary level, certainly you don't need to add a supplement on top of that.
Yeah, I come close.
Good, good.
Looks like I'll have to add some vitamin D. Because my doctor's got me on calcium, but she didn't say
Mhm.
anything about D.
Yeah, the tough thing about vitamin D that's found in very few natural foods. And the other way we get it is through sunlight, but in a Wisconsin winter, sunlight can be very scarce, so we can't really rely on that effectively. I believe on that handout there's a couple food items they have that vitamin D is found in. Fish is one of the ones that you can get it from. I don't know if either of you are fish fans, but
Egg yolks. I also read it's available in mushrooms if they're cooked.
That's one I don't know. But sometimes they do fortify things with vitamin D as well, that you buy at the store. But generally, calcium is easier to find from a dietary perspective than vitamin D is.
Oh, here we go. Egg yolks,
Yeah.
salt water, fish liver, and fortified milk.
Yeah, so not the most extensive list, but at least there are some options there. And that's why you do see a lot of people on vitamin D supplementation. So it is nice that we can kind of attack bone health from not only from a dietary level, from an exercise level. You can kind of do those things together to help facilitate your best bone health that you can have. So a couple of different things to keep in mind kind of going forward regarding that. And the exercise certainly doesn't have to be strenuous. It's just something like walking 30 minutes a day. I know it's tougher in the cold weather that we have, but it doesn't have to be, going to the gym for 2 hours every day or anything like that. It doesn't have to be major high impact either. Just something, like I said, as simple as walking will put enough stress on those bones that can help them grow and stay healthy. So I don't think you have to go out and run a marathon.
It doesn't matter if it's all at once, or say you go 10 minutes in the morning, 15 in the afternoon, whatever. That all works?
Yeah, either way, whatever
okay.
fits your schedule. I know we all have busy schedules, so whatever fits into that.
Okay.
It doesn't have to be all at once. It can be based around what you can do.
Okay.
So if I carry the laundry from the bathroom to the dryer one piece at a time, or to
There
the
you go.
washing
There you go.
machine?
Get creative with it. I like it. I like it.
Take 10 minutes.
Then you can stay
Get
warm
the
too,
laundry.
right?
Yes.
You don't have to brave the cold.
Right. Well, people walk in the mall here.
And we got the exercise room right here too.
Yeah,
The
that's
treadmills
true.
in it.
Oh, and is there one here? Nice. Good, good. So it's good to have those resources available.
Very interesting.
Do you have any questions about screening for osteoporosis or treating it? I know we've talked a lot about prevention to this point.
Yeah, but if you just keep up on your calcium and D, that should take care of it, right? Or keep it up
It
there?
should help mitigate the risk. Now like anything in medicine, there's no 100% cure-all. This will prevent you 100% from getting any sort of disease. Unfortunately, that's not the case, but it can help decrease your risk, certainly. Make it less likely that you'll develop that disease, that you'll have a fracture or something like that.
You want to tell us about the medications that treat it?
Sure. There are several different classes that we use. The major one that we use first is called bisphosphonates. Okay, it's a long word that you don't have to remember, but it's basically there's cells in our body that break down bone and cells in our body that build up bone, and they're kind of always in a constant back and forth a little bit. So what bisphosphonates do is they help kind of turn the tide on that battle a little bit, to put in more favor of the cells that build up bone, and kind of curtail the cells that break down bone a little bit. So it helps from losing bone further, and it actually helps build it back up as well. And actually, once you start on this sort of medication, they follow these bone scans periodically to see if the medication's having a decent effect or not. And they can actually see if it's doing what it's supposed to be doing. And these medications are available in either an oral form or an IV form. The oral is usually once a week that you take. And the IV is actually an infusion. You only need it very kind of sparingly, once a year, once every 6 months, that sort of schedule. But you have to get poked for it, which is the downside. So, and that's generally the first kind of class that we use when someone's starting an osteoporosis treatment regimen. There are a couple others that are also geared toward those cells that break down bone as well, that we can use if you find that first class isn't doing the job that it should. And then we try to find something that is effective for each person. There are a few, like any medications, there are adverse effects that can happen with them. Pretty well tolerated. They can cause some GI upset. A lot of medications can kind of do that. There are also a few more rare side effects. They can cause something called atypical fractures, which is basically a fracture in a spot that you're not considered likely to have. But this is a more rare side effect of it, as well as it can cause some jaw issues too. But again, pretty lower down in terms of the percentages of people who get those. But it's always important when you're starting any new medication to ask your doctor about the side effects, what to watch out for, what to be cognizant of. So, yeah, it's a bit annoying for the oral one. You have to sit upright for 30 minutes after you take it, because it can cause some issues with the throat as well. But hopefully you don't get to the point where you have to take these meds.
It's better to walk now.
Right. And that is a very good point. Just in medicine in general, it's always good to do things to help prevent development of a disease rather than, think about it after the disease develops. Just from an overall health perspective, that's what, as physicians, we certainly strive for our patients to do. We like everyone to be healthy for the long term and not just to see people after they develop something bad. So we've talked about prevention, we've talked about treatment. Any questions about the screening for osteoporosis?
Yeah, they put you in that machine and it goes around.
You've had it done before?
Yeah, just recently.
Yeah. Was it a good experience getting it done?
Yeah.
Was it pretty quick or?
Yeah, it's quick, simple, painless.
Good.
Yeah,
So
they
you-
did what, the hips and I know they did this area.
Okay. Yeah, and they monitor that periodically, and as I'm sure they've let you know kind of about the schedule for that. But
Yeah, I've had it twice.
I
maybe
think this
3
was my
times,
second
and-
time too.
Yeah. Just 68, so it's
Yeah.
not every year.
have they told you what they look for during those tests?
Why don't you tell us?
There's a certain score that we look at. It's called the TScore. I won't get into all the details about how it's kind of come to be, but basically we look at the severity of that, how negative it is, and if it's more negative, that's a diagnosis of osteoporosis. If it's less than -2.5 to be exact. And if it's less negative but still lower than normal, it's what's called osteopenia, which is basically you're not there, osteoporosis yet, but your bone's a little less strong than it should be. It's kind of a warning stage, I guess, to just hopefully that it doesn't go any further.
Is that where the osteoarthritis comes into play also?
So osteoarthritis is different. That doesn't really deal with bone mass and bone growth. That's more of just talking about a joint problem. Often you have joint space narrowing and you get pain and things like that. That's also a kind of a wear and tear thing you develop over time. But it's different than osteopenia and osteoporosis. That more deals with the joints themselves. I'm glad you two are getting screened and staying up to date on that stuff, because not everyone does. Good for you.
Well, once you get in the areas where it kind of affects you, then you're more interested than another person.
Yes.
Yeah, it's a good thing that they do to catch this stuff earlier. see what they can get out in front of it. Any other thoughts or questions right now?
I was just trying to think of somebody.
Dr. Avapati, do you have anything you'd like to add?
Hi, I'm Dr. Avapati. I work in the Marshfield clinic with Dr. Lakin. I just so I don't know what you guys talked about so far.
I basically gave them an intro about kind of bone health in general, how it develops over time, what we need to watch out for. Talked a bit about prevention, calcium, vitamin D, exercise, smoking cessation, alcohol limitation, things like that. And then discussed treatment options, screening. So I think we've covered kind of broadly aspects of the disease and bone health in general, and kind of seeing if I could answer any more questions that they had at this point.
Kind of ran out of questions.
Yeah.
You feel like
supposed to be telling us.
Do you feel like you'll be able to kind of implement some changes down the line after this discussion?
Yeah, I gotta get me some vitamin D.
And oftentimes, your doctor will check a vitamin D level, especially if they think you have a bone mass problem, to see if you have an adequate level in your system or if you potentially need more supplementation. So that could be something to watch out for down the road too.
And a lot of the calcium supplements come with vitamin D.
Yeah,
So
see what I
instead
got, I
of
don't
plain
think, yeah.
calcium,
We'll have
get
to
the
check
ones
it.
with some vitamin D.
And that's convenient to just have less pills that you have to take. It's always less is better than more, right?
My dresser looks like a drugstore.
And we don't want to add to that too much if we don't have to, in terms of the sheer quantity.
Drink more milk, I guess.
I should drink more milk myself. I've never been a real milk fan. But
I always was. But now that I had to go to, I'm supposed to be down to, what is it? Below 1%. To me, it tastes like water. So I made it down to the 1%, but that's about all the farther I can go.
That's good enough.
I hope so. That's what I went down to. But yeah, I love milk, but I haven't been getting enough. I know that.
if you see other items on that list that you like more, that have decent calcium kind of supply, certainly you can.
Sardines.
If you want to.
Right here. Egg yolk.
If you want to bring those more into the diet, you certainly can.
Fish liver. Yeah, there's only, what, 4 items. Was finally eating liver, but now they say, no, that's no good for you. No animal internal organs. So now you're down to 3. And if I'm going to eat an egg yolk, I'm going to eat the white also.
Fair enough.
Yeah.
And I think if you go to the store, sometimes they do fortify some things with vitamin D. So if you're at the store, you're getting your milk. If you want to see on the label there,
Oh.
if it mentions vitamin D, that could be another option.
Most milk should be fortified.
Yeah. So you can see how the quantity that's in there,
Okay.
and then kind of use that as a source as well.
Do any of your beans have D in them? Because, like they say, legumes or garbanzo beans or...
Not really beans, but broccoli, kale, those have calcium in it,
Oh.
but not vitamin D.
Green vegetables?
Mm-hmm.
Oh, I eat green.
Baked beans has some, not a whole lot, but soybeans.
Yeah, but that's the calcium.
Oh, you're looking for the D.
Yeah.
No.
Yeah, 'cause she's already got me on enough calcium.
Yeah, we have less dietary sources of calcium D. Usually, most of the calcium D is synthesized in our body from sunlight, but we don't get that enough in Wisconsin. So
Sun?
we-
What's that?
So we have to supplement it
Yeah.
with the supplements.
A lot of people are vitamin D deficient. Just like it's fairly common, just because of the lack of dietary sources in the climate that we live in here. So it's a bad combination for vitamin D quantity.